Since 2015, we've lost funding, vital funding for the Stand Against Cancer. Not only access, but the funding disappeared throughout the state of Illinois. As we have continued to make sure that all uninsured women who come to us for breast cancer or cervical cancer screening, which that's what the Stand Against Cancer focuses on, we've never stopped that approach. We've done over 175,000 screenings for women since 2007. With the Affordable Care Act, a lot more women have gotten on insurance, but we still have gaps. We've got serious gaps. We had a strong history of women, even if they were uninsured, they could always come to us for services. But when it came to mammography, we're not a hospital system. We did not have the funds to really be able to support that. Through relationships and just hunkering down, even going to our majority community-based board and saying, do we turn this off? And I think, again, that's the difference with a mission-driven organization. We don't have deep pockets. What we have to do is really make sure we stand on what we are and who we are. And so we've made some tough choices. We've had to cut back in other areas, but we've not stopped the program. And so in the last couple of years, every time we say, well, maybe can we afford to do it? But we've caught 5 to 7 cancers. These are cancers that, undiagnosed, the outcomes wouldn't have been good. It's not always just the data, but it's the stories. I can remember in my career as a nurse, but also someone who grew up in downstate Illinois, listening to my mom's story about how my maternal grandmother died at the age of 37 from breast cancer. And that my mom's last memories of her mom is cupping her breast in pain while she was trying to cook for 8 children. And then disappearing one day, and then not seeing her mom again until they took all the kids out of school and they took her to her mom's bedside as her mom was dying. And that story always stuck with me. Now, fast forward, I can remember making rounds in one of our health centers, and one of our staff came to me and said, Donna, I need you to talk to this mom. And this was before the Affordable Care Act, when it wasn't unusual to have many of our patients who were uninsured. I can remember meeting this woman, and she had the 2 cutest daughters. They were like 7 and 5. And she said, I've got a lump in my breast. It's probably cancer. And I probably need treatment, but we have no health insurance, and I want the American dream. And I said, what is that? And she said, I want a house. And I remember the first thing that hit me was my mom's story. And I thought, 40 years later, women are making these decisions. And I thought, no, the major asset isn't a house, it's you if your 2 daughters lose you. Throughout the years, we have screened thousands of women and really made sure that if a woman is uninsured, that her opportunity to get that vital screening, she's not making a choice between paying a bill or kids' tuition or to get this preventive screening. In 2007, we created an awareness program called Pinasister or Examinate Madre. And again, this was a program that we started on Mother's Day to continue the awareness through our faith-based partnerships throughout the state. It really evolved out of the work that we did with the Stand Against Cancer and working with our faith-based partners in really Black and Latino communities. The excitement is that as the women came together to really look at healthcare disparities, it really was around education and making sure women had access. I know that for most women, most working women, if it's a choice between paying school tuition, making sure that the heat is on in the house, paying the rent or mortgage versus a preventive screening, we know the decision. Women in Illinois don't deserve to go back to where we were 10 years ago. They deserve to be able to know that they have access to affordable services, access to the necessary screening that they need in order to continue to be a productive parent, support their family, and have the best health outcomes.